Officially found out, I'd say around 7th grade.
It was like 4th grade, probably.
Maybe 3rd or 4th grade.
Mainly in middle school, around 7th or 8th grade. I think I'd been tested for it maybe in elementary school.
I'm very impulsive at times, and I can be very distractible, and I am very hyperactive at times.
Trying to stay focused on things, not get distracted. There's distraction, but also there's just thinking about a ton of things at once. Not even like not like tangible outside world distractions, but distractions up here.
I went like a year without medication, but I saw like a doctor once a month, and then they started me on some pills that I took every day.
I am on medication. I've taken the same dosage for the entire time. It is very helpful.
I take 2 different medications, one in the morning and one at night. I take Vyvanse in the morning, which kind of helps with the impulsivity and hyperactivity. Then at night, I take this pill called Intuitive, and that helps with kind of anxiety, and then again, it's the impulsivity and the distractibility.
Sophomore year, I was prescribed for some concentration pills. Yeah, I took the concentration pill every morning for sophomore year.
I'm able to kind of control myself a lot more. Trust me, if this was a few years ago, right now, it's hard for me to even talk at this speed, and I'm off of medication because I talk so fast. But I'm a lot more able to control myself because of medication. The side effects of my morning pill, which there are many of, and so it's nice because before I took that night one, it was hard for me to eat. I wasn't very hungry a lot. I noticed I had anxiety a lot more. It wasn't very fun, but now this one kind of helps counteract that, so it's been working out pretty well for now, about a good year.
At first I went through like 5 different medications that were completely useless. Ritalin is useless. Don't take Ritalin. Ritalin is useless. But what I take now is nice.
And they increased my dosage over time until like 7th grade. And then they began slowly decreasing my dosage until I was fully off the pill by like the end of 8th grade.
When I compare it to when I did take it versus when I didn't, first 2 things I noticed were definitely my appetite just went away. And sometimes I just felt really anxious, or just like my anxiety worked up. Junior year started, and I actually didn't take them at all until around my SAT testing, and I was still prescribed, so it was okay. But yeah, for the majority of junior year, I actually wasn't taking them, so I guess it kind of goes back and forth on the choice.
To be honest, standardized testing for me is probably the weakest thing about me as a student. I always struggle with standardized testing.
The school system isn't very interesting, and I know I crave interesting things, and just when school is not interesting, it's not easy to listen or pay attention at all.
Things do not work very well in the public schools. They're not trained, nor do they really have programs to help kids with ADD or ADHD. I've had a lot of teachers who are very ignorant, and even if the signs were obvious that I needed help, they were very impatient with me.
I would make classroom activities more interactive between student and teacher rather than just like copying notes off a board or reading a book. In high school we have like discussions. Obviously you can't have the same level of discussions, but if you made the classroom more of an interactive space, kids who struggle to be interested and focus would focus more since they're having fun while learning.
To have people know exactly what it is, so there's not some debate over what is ADD and ADHD and what are they together. Like, first of all, define them, or just give some description of them, so kids aren't just going off of rumors. Yeah, just make sure people know what it is they're dealing with first.